Hi everyone, my name is Cassie Angelo and this is my case study 1. So just a client description. So he's a 3-year-old male. He has limited verbal functional communication. He's actually being trialed currently for an AAC device. He attends preschool 4 times a week where he goes for about 2.5 hours each day. His diagnosis is autism spectrum disorder, and he also has a speech and language delay. So some of the behavior of concerns are throwing objects. So this is any instance in which the client picks up the objects with his hands that is not intended to be thrown and throws the objects farther than 1 foot. So some examples of this includes throwing objects, throwing toys, throwing food, his water bottle, things like that. And some non-examples include throwing a ball, or if he's engaging in an activity and the object that he needs falls on the ground. So some reinforcement and punishment contingencies. So right now, some positive reinforcement and positive punishment is occurring. So the parent provides the attention to the client by engaging in reprimands after the client engaged in the throwing behavior. So he's being positively reinforced by the parent providing that attention, and then the punishment is him being reprimanded. So he's still gaining access to that attention. So something like a client contingency could be right now is that if I throw objects, then I will get attention. So the assessment that we did was a functional behavior assessment, or an FBA. And I included some of the ABC data that we did. So one of the antecedents was that the parent speaking on the phone in another room. And then my client threw blocks, and this was 5 times he threw the blocks. And then the consequence was that his parent yelled at him, "Stop throwing blocks." My client immediately started laughing and then would engage in the throwing again. Another example is that the parent was watching TV and ignoring the client vocalizations, which he was trying to gain her attention that way, but she was ignoring it. The client threw the TV remote at the TV, and then the parent yelled, "Do not throw things at the TV." And then my client again started laughing and would continue to throw things. For the last example is my client called the parent's name by saying "mama" when he was in his room, and the parent ignored. The client then threw toys in the direction of his mom, and he did this 4 times, and then the parent yelled, "Stop it, I'm on the phone." So with the results of our ABC data and the functional behavior assessment, we found that 100% of the opportunities is to gain access to attention. So his behavior of throwing objects is being maintained by gaining attention. So some of the interventions that we did was non-contingent positive attention. So this is when we provided positive attention throughout sessions. So the examples could be like we would give him a thumbs up, we would give him hugs, high fives, social praise. Maybe we would play like a quick little clip of a song, things like that. We were constantly giving him that positive attention throughout the session. And then we also used an attention card. So I did attach the picture down here at the bottom of what it looked like. So we would honor all forms of my client's efforts into using the card. So we would present the card when he was maybe on the floor, at the table, wherever, but in close proximity so that he can access it. And some of the examples that we honored was him just looking at the card, maybe tapping the card, exchanging the card, anything appropriate that he did. And then we would honor that. So if he even just looked at the card, like, "Oh, you want attention," and then give him attention. But if he, for example, took the card and threw the card, then we weren't providing any type of attention. So some of the motivating operations, his establishing motivating operation was a deprivation of attention. So he was being deprived of attention. So that was the MO. And then the evocative effect was that he would either engage in the attention card, so requesting attention, or we would give him that non-contingent positive reinforcement in the hopes that it would increase in the frequency of him appropriately gaining the attention versus throwing the objects. So here's our reinforcement schedule. So when we first did the non-contingent positive attention, prior to the start of the intervention, we did a variable interval schedule of 10 minutes. We found that, he would engage in these throwing behaviors about like every 10 to 15 minutes. So we started on a VI 10 prior to the start of intervention. So during the start of intervention, we immediately moved to a fixed interval of 1 minute. So we were consistently providing that attention every minute. And then during intervention, we switched it to a fixed interval of 5 minutes because he was able to then understand like what was happening. And then we switched it to a fixed interval of 5 minutes. And then by the end of the intervention, we were able to move over to a variable interval of 5 minutes, which was awesome that we can do it variably instead of just a fixed rate. And then for the attention card, prior to the start of intervention, we did a variable ratio of 5. So every 5 times that he would try to gain the attention, we would provide the attention. So at the start of intervention, we did a fixed ratio of 1. So every single time that he looked at it, touched it, exchanged the card, whatever it was, we provided that attention for him. And then during intervention, we moved to a fixed ratio of 3. And then at the end of intervention, we were able to move to a variable ratio of 3. So every 3 times, he was able to gain that attention. So some generalization and maintenance. So maintenance, what we did was that once the client mastered the interventions, he was only reinforced if appropriately gaining that attention in the absence of throwing objects. And then the generalization was for settings, he was doing this between the school and the home setting, and then across people. So we, taught or showed the skills to the parents, teachers, and then the therapists that were working with him. So some of the outcomes. So the client mastered appropriately gaining attention with the use of the attention card after 10 sessions, where throwing objects went to near 0 levels, which was awesome. So after 10 sessions of doing this intervention with him, he was able to master it and understand that if I request attention using this attention card, then I will get my attention or get their attention, and then I won't have to throw these objects. The client also mastered frequent schedule of non-contingent positive attention after 5 sessions. So this is where we decreased to a variable schedule, which is currently still being implemented for maintenance purposes. We're still currently giving him that non-contingent positive attention on a VI schedule. And then due to inconsistency of staff during sessions and staff not being available to provide sessions, the client has not shown maintenance of the skill with using the attention card, and throwing behavior has increased back to baseline levels. So what we're going to do is we're going to repeat the intervention procedure of implementing a fixed ratio 1 schedule of using the attention card. And then the supervisor is going to retrain current staff on intervention implementation. So hopefully with repeating back to the intervention at the beginning, those baseline levels that he's currently showing could go down again and decrease, and we can get that increase of using the attention card.